Welcome to another episode of Impact Uganda on NBS television, even as we celebrate 15 years of informing to transform. This is the show where compassion takes center stage. And today we dive into the inspiring world of the fight against HIV and AIDS, TB and hepatitis, and the urgent need for affordable and accessible medication. Join us as we shed light on the impactful campaign led by AIDS Healthcare Foundation and its dedicated team, bringing hope to those in need. Since 2003, AHF in Uganda has been tireless in their efforts, operating in 64 clinics across 28 districts and collaboratively serving more than 149,000 patients. AHF Uganda Cares has been a beacon of hope. They provide us with not just medication, but also emotional support and guidance. Today, we shine a light on the extraordinary campaign led by AHF, challenging the issue of farmer greed. The AIDS Healthcare Foundation is making a great impact on the lives of individuals who are living with HIV and AIDS right here in Uganda. And today I'm sitting with Henry Magala, who is the country director of AHF. And I have a couple of questions that I'd like to ask him with some of the campaigns that you're involved in. But before I even get there, won't you tell me a little bit about AHF and what you guys do here?
AHF is in full AIDS Healthcare Foundation. It's our parent organization in the US that has been around since 1987, 1986, trying to provide HIV care and treatment. In the US, it's the largest organization, but also it's also involved in advocacy, because sometimes you need to have right policies to be able to provide the care and treatment that you need. So in 2002, AHF decided to do some work in Uganda. And so in that year, AHF set up the first HIV clinic outside Kampala, and it was the first in a public health facility. So since 2002, the organization came to be called Uganda Cares, by the way, when it in its formative phase. And it has expanded its operation from the first HIV clinic, which was established at Masaka Regional Referral Hospital. And as I said, it has expanded from there to now covering 28 districts, taking care of 150,000 HIV patients within 64 health facilities.
150,000 individuals is quite a big number, and that must have some kind of strategies that you guys employ in order to reach that number, such as perhaps the campaign, the farmer campaign that you're involved in. Why don't you tell us a little bit about that initiative and what it entails?
The farmer campaign is about access of drugs to developing countries. And we have seen companies that are making these drugs a bit minding about the profit that they get instead of accessing these drugs to developing countries like Uganda at affordable prices. We have a company called Gilead, I think has been on in the media for some time. It produces HIV drugs, but not only HIV drugs, it also produces drugs for hepatitis, TB, and then other drugs. But you find that when we look through the operations, we find that some of the drugs that we would have had right now in our country, countries like Uganda, they are not available. And one of the reasons is that it has put up patents. It has patents. But even these patents, the opportunities to grant, sub-patents or grant rights to produce these drugs within developing countries like Uganda, but it has not done so.
This campaign seems to be very important. What impact has it made so far right now in making it accessible, making these treatments accessible to Ugandans?
The first thing is making the information available to all stakeholders to know that there's a kind of immorality where, drugs that are good, drugs that should be accessed to countries like Uganda are not accessible. And so that information has gotten out, and we have had the community or had the patients get to know about it. And the most important thing is that the patients or the clients have been able to raise their voice, pleading and appealing to Gilead to reconsider their operations. And one of the things that they have done as patients is to write letters to Gilead to say, please ensure that you grant patents so that these drugs are made more cheaper and available.
Would you perhaps expand a little more on some of the work that you get into outside of the pharma campaign as well?
Critical organization is an HIV/AIDS organization, and one of the services that we provide is care and treatment, ensuring that those that have HIV are first of all diagnosed, and not only before diagnosed, their is about the dangers and risks of living and having HIV. So we do a lot of prevention work, and in this case we ensure that we send word there, we mobilize, sensitize the community about the need to know your HIV status. And so a good number of people come for testing. We have staff, and we are doing it actually collaboratively with other stakeholders like community-based organization, national organization. We empower them to be able to have the tools that they need to test. And so testing is the first point. Then those that are found to be HIV positive, they are linked into our care and treatment program. And in this way, as I said, we are collaboratively doing it with Ministry of Health and other service providers. As HF, we ensure that is the critical human resource that's needed to ensure that a person who comes positive is well cared for, is taken through the treatment, procedures and all that. We ensure that enough human resources are available. So as HF, we provide human resource.
The work that AHF does definitely needs collaboration, and it's a big work that needs to be done, or rather even, let me say, a big impact that has to be made. I'm sitting here with Kenneth, who's the Executive Director of HEPS, and let's ask him a couple of questions about their collaboration and even some of the initiatives they get into. Kenneth, how are you today?
I'm fine, thank you. How are you?
Thank you so much for joining us.
Thank you.
Just curious, for somebody who doesn't know what HEPS actually stands for, what is HEPS? What is this coalition, and what do you guys do?
So HEPS is the Coalition for Health Promotion and Social Development, abbreviated as HEPS Uganda. And our abbreviation doesn't rhyme with our full name.
But it's just,
yes. It's just that when HEPS started, wasn't working as a coalition. But along the way, then we started to work as a coalition of health professionals, of civil society members, of individuals within the health sector. We noticed that it's important to work together. So our approach is working through partnerships and coalitions.
I'm talking about partnerships, your collaboration with AHF. What inspired that particular collaboration, and what was the need for HEPS to join AHF in this initiative?
Yeah, so for starters, HEP's fundamental role is promoting access to essential medicines. And we started doing that as early as 2000. And we've spent 23 years working to promote access to but he's now 70 years. And so it's such people that inspire us to do more. Before, HIV was a death penalty, but now people live normally with HIV, with ARVs, and if you're taking them well, then you're guaranteed of a healthy and long and normal life. So that's why we work towards ensuring access. Despite that, globally we still have 38 million people living with HIV. and 10 million have no access. So 1 in 4 have no access to antiretroviral therapy. And even in Uganda, we still have those that are not on treatment. Not because we don't have it, but because they are not tested. Even some that are on treatment are not adhering well. But we join partners like AHF because they are more global.
So with somebody who's watching right now who says, you know, I don't know how to access this treatment, I don't know where to go, I don't know what to do, and with you talking about how accessibility is now wider than before, what would you say to that person?
So the message I would send out to such people, if you test HIV positive, please go to any public health facility or at any AHF center. They have centers of excellence in several parts of the country, and you'll have ARVs that are tolerable. You know, we've also come a long way where we had very toxic ARVs, but now we have very high impact and tolerable ARVs. So they are available for everyone. And the challenge now is looking for those that are not yet on treatment, have them on treatment, because we have the treatment.
Your collaboration with AHF is absolutely impactful, and thank you so much for joining us today.
Thank you.
Now that we have explored the collaboration with HEPS Uganda to create a lasting change, stay tuned as we hear the inspiring journey of Trevor and first-hand accounts of AHF Uganda Care's impact. We'll be right back. Trevor, thank you so much for joining us today on Impact Uganda. But why don't you tell us a little bit about who you are and perhaps your story as well?
Thank you so much, Victoria. My name is Emojel Trevor. And as a person living with HIV, I've navigated a share of stories and experiences being positive, but very notably was when I was brought to Uganda Cares. And I remember being brought to Uganda Cares on a hospital bed. I was very sick and I was TB positive at the time, but the facility I was from did not have medication for TB as consistent as I needed. But thankfully, when I came to AHF Uganda Cares, because of the consistent supply of medication and psychosocial support, I was able to recover in a period of less than a year. And ever since then, I've had a very impressive, tremendous track record of achievements, different excellence things in. For example, from high school to university, I was on scholarship. I did so well at university, I graduated. I got a job now here at AHF Uganda Cares as a youth officer, coordinating youth activities on a national level. And so I believe this has all been because of the affordability and accessibility to this life-saving medication that I very much needed. And this is what I believe people out there also really need, for them to have such success stories.
Wow, such a story of a transformative change in your life, and considering in the span of time that it has happened, it's incredible. How has the successes of this particular campaign, pharma campaign, impacted your life? And perhaps maybe you can tell us a little bit of a story about the youth that has been impacted also as a youth officer.
Yeah, definitely this campaign is for us to make medication affordable and accessible, and that is the level of impact I can speak of, because at least now we have more people able to access medication, because these are life-saving medications. This is about life, and so if people are able to access this medication, and that's success for us, and that's what we are pushing for. I know it's not yet to the level we want, but we are still very actively pursuing the campaign.
So tell me, as a youth officer here at AHF, what are some of the experiences or some of the people that you get to meet? Tell me a little bit of a story there, perhaps of some of the people that you have encountered, the impact that AHF has had on their lives, such as yourself as well.
Yeah, AHF is very intentional about young people. And I must say, first of all, from the girls' wing, we are not only looking at girls living with HIV, we also have those who are in the community that are marginalized. And so we have the Girls Act program where we give things like sanitary pads. We issue out support. We have education support to support those who have failed to go back to school, to enable them to have a decent education. So that is one hand we are doing. And then we also have boys. We're trying to engage them in economic activities that can help them, find a job, find something to survive on for well-being. Yes.
Now, Trevor, looking back at your life and where you are right now, would you say that the AHF has provided some success, transformation in your life?
I think some is an understatement. I think it's more than just some. Because 2014, when I came here on a hospital bed, I couldn't imagine I could get this far. Because even my academic success, when I came in, I was not doing well in school. But my academic success, getting to university and scholarship, getting here. This year I've boarded a plane twice, all because of AHF. I've been able to impact more young people through the program, and we're reaching out to so many. So it's giving me an opportunity to serve young people on a wider level, not just Uganda actually, but across. So it has invested in me tremendously, and I'm looking forward to giving back as much as possible.
And that concludes another thought-provoking episode of Impact Uganda. And we hope that you have been inspired by AHF's commitment to provide affordable and accessible treatment for all. Join us in the next episode as we continue to shine a spotlight in the impactful CSR campaigns that are making a difference in Uganda. Until then, let compassion guide your actions, and remember, together we can make a brighter future.
My name is Marjan Zenab Ismail, the President, Rotary Club of Kampala Chibuli. This initiative started way back then in April, where we wanted to adopt where we got our name. We adopted Chibuli because that is where we got our name from, and we wanted to give back to the community. Because in Rotary, we normally do such projects for giving back to the community, and we're trying to create hope in this Rotary year, 2023 to 2024. So this is the fourth project that we're doing this year, ever since the year began, because we've already done like 3 projects in this community. So this one is a cleanup. But the most important reason as to why we're doing it, because actually when we were doing the cleanup or when we did the needs assessment, the place was really, I don't even have the right word that I can even describe it. People are falling sick, they don't have medicine, the place is very dirty, and the KCCA, it has really tried to come up and help them, but themselves, they could not even do what we've really done today. Basically because when you go down there, you'll find there are very funny medical hospitals which normally don't even give the right drugs to the sickness out of the dirty place or the garbage that is down there. And the main purpose, we are only focusing on the 7 areas of Rotary where we have water and sanitization, we have basic and literacy education, whereby we are going to be training some people on how to make books, so that at least the community, we are giving back to the community. And the other one, we have economic empowerment. This is very important because as people in the community, people in the ghetto or in the lower Chibuli, we need to empower them. And today we are really going to empower them by teaching them on how to make petroleum jelly and mosquito repellent products. For example, candles. We're going to also make bar soap. This is really very good because it's going to be giving them some little money. And on top of that, we're going to have a small session on the financial literacy. We shall train them on how to manage their money in the community. We are also joined with other Rotary clubs. The partnering sponsors that we have on board, we have our mother club. They're very beautiful. They've been sponsoring up and they've really supported us from day one, and they really welcome this initiative. The other clubs that we do have, we have Match India West on board. We have Match India, then we have Luvowa, and then we also have Chambogo. So all these came together so that we can really focus on the 7 areas of Rotary, and I do believe it's just about giving back to the community, and we are creating hope to these people that they can also make it. And today, if you are really cleaning Chibuli, next time they will also get the energy and they will go and clean up another place.
In the Pearl of Africa, two nations unite to strengthen their economic ties and explore new horizons. Welcome to the Uganda-South Africa Trade and Investment Summit 2023.
We are very happy to partner with the government of Uganda in hosting this